Good morning. My name is Dr. Krishna Mohan, Lalukota. I am a consultant interventional cardiologist at Continental Hospital, Gachibowli. Today we are going to talk about chest pain. Are all chest pains are due to cardiac causes? That means anything related to the heart, or are there any other causes? Chest pain is a very common symptom and it may be related to your heart or may be related to your lungs, muscles, stomach or intestines, gallbladder and many other reasons. The most important cause which people come to hospital is the chest pain, and the cardiac related causes are about 20 to 30% in terms of chest pain. 70 to 80% of the chest pains are unrelated to the heart. So today I am going to explain what would be the presentation. Firstly, if it is related to the heart. A cardiac related chest pain usually is more like a discomfort rather than a sharp pain. And the area which it involves is in the center of the chest or across the chest wall, and it feels like something coming from inside. More often than not, this pain can actually radiate or can go up to your throat, jaws, or to your shoulders, one shoulder or both shoulders, and very often to your hands up to the fingers. So this sort of pain, if you ever experience, which you cannot pinpoint to one point in one point in your chest, then it is more likely from your heart. Under these circumstances, it is best you go to the nearest hospital and get investigated by means of a simple test like an ECG in the first place. If the ECG is abnormal, then obviously it confirms that it is from your heart. And if the ECG is normal and if you are pain-free and you had these sort of symptoms, maybe you need to undergo further investigation to look for any cardiac causes. Secondly, the commonest other presentation like we see in the young generation now is because of anxiety. Anxiety can lead to muscle spasms, and muscular pain is one of the commonest reasons for chest pains in the day-to-day practice. Young persons who are active and start going to the gym, first 2 or 3 days they can start getting the chest pains, usually in the center of the chest, but many of these patients complain that this pain is particularly localized to one point, and this sort of pains are unlikely from your heart. And these sort of pains generally do not radiate. However, some patients may also feel other associated symptoms because of pure anxiety, like feeling palpitations, breathless, or sometimes sweating with these sort of pains. In any case, if you get any chest pain, it is better you go get yourself checked. But this sort of presentation, like where the localized pain and a sharp pain, which is actually exaggerated by the movement of your hands or by the local pressure, are unlikely from your heart, and they are very likely to be from a muscular cause. The third commonest presentation is the gas pain, or what you call a dyspepsia. So if you have hyperacidity, it may be because of poor dietary habits, irregular dietary habits, smoking, excess alcohol consumption, or chewing tobacco or gutka. All those sort of things can give rise to dyspepsia or hyperacidity syndrome. So unfortunately, this actually can mimic like a cardiac pain in majority of the patients, because the pain which appears in the dyspeptic or gas pains, they can actually come in the center of the chest, and they are usually not localized, and sometimes it can radiate up into your throat because of the acid reflux. In any case, if you have this sort of pain, it is best you go see a cardiologist as well as a gastroenterologist, and they will be able to give you a clear solution. The other gastrointestinal cause which can give you chest pain is the gallbladder pain. This again can be more like an ache and can also mimic cardiac pain. So under these circumstances, it's best you go get yourself checked. Obviously, a doctor would be able to help you recognize whether it is from your heart or from your gallbladder in most of the cases. The other causes which can give rise to chest pain is anything related to your lungs or lung coverings especially. If anybody has any lung inflammation because of a viral infection, they also can present like a cardiac pain or a chest pain. So if you have any pain which increases with breathing and feels a little bit better when you actually breathe out, this pain can be from your lungs, called pleuritis, or anything related to a lung infection. There are other common causes, like sometimes radiating pains from a nerve infection called shingles or herpes zoster. So under these circumstances, in a patient with herpes zoster, the pain again is localized to one part of the chest. It can be on the right side or left side, but these sort of patients, they actually also get small vesicles or a rash. So this pain can be intense and very severe. So if you notice any chest pain with a rash, do show that rash to your physician, and they will be able to recognize and tell you whether it is cardiac pain or anything related to shingles. Apart from this, there are multiple other causes, like a muscle pull in a patient, or a person who's actually gone to gym or moving furniture or cleaning anything at a height, and those sort of pains usually can present with the pain in front and in the back as well. Apart from this, there are some other serious causes where pain occurs quickly, like any tear in your main artery called aorta, which is called dissection, and those patients actually present very badly. To summarize, what I want to say is, like, if you have any chest pain, don't panic. Chest pain is not always from your heart, but at the same time, remember, if it is from your heart or anything related to the heart, it can lead you to serious symptoms and serious consequences. So under these circumstances, it's best to go and see your physician first. Get some routine investigations like ECG, echocardiogram, or treadmill test if you are able to do, or any other test suggested by your physician or a cardiologist.